Okay, thank you all for coming. My name is Dr. Bales, and my title of my presentation is A Breakthrough in Drug-Free Pain Management Therapies. And actually, you're going to see it's really many breakthroughs, but as we go through. An announcement first for our local audience is we are doing a raffle for a free pain management therapy session with myself, so Jalene's going to come around and pass out the tickets. Okay, so a few disclosures first. In addition to full-time practicing here, I own my own medical device company called Bales Photonics. We design and manufacture the BioPhoton 100, which I am going to talk about, that therapy. So that's mine. And we're going to have some thermography slides showing before and after treatment with that device. Other than that, I don't own, work for, or I'm not compensated for sales for any other of the therapies here, besides the ones you receive from me here, or any of the supplements. I try not to give brand names. I'm just giving ideas on supplements. So, disclosure. Some of the goals for the lecture, I'd like you to understand why we really like to go with drug-free pain management, some of the dangers of the prescription meds and even the NSAIDs, more the over-the-counter anti-inflammatories. I'd like you to learn about the therapies which form the basis for pain management here at Center for New Medicine, and also the supplements which we endorse here at Center for New Medicine to reduce inflammation and pain. So the sections are going to be why drug-free pain management, followed by the pain management therapies at the center, and then supplementation and pain management. So why drug-free? I mean, they look so pretty here, don't they? All the different colors of the rainbow. Okay. Well, the Institute of Medicine actually reports 100 million Americans suffer from chronic pain. Chronic pain, as defined by the FDA, is someone who's been in pain for more than 6 months. And I think anybody that's been in pain for more than 6 months, it's pretty chronic and it's pretty bad. It's pretty annoying. It costs this country about $600 billion a year. That's in lost job. That's in compensation for someone that can't work, workers' compensation, homestay, and that added together. They commented, this Institute of Medicine, that all too often the treatment is delayed, it's disorganized, it's inaccessible, or it's ineffective. To me, that equals what we're doing now. The pain meds just are not working, because that's the number one go-to. Besides maybe a little physical therapy, that's the go-to of the pain meds. If you have pain, it's the prescription, and here you go. What starts in a local area can spread to the whole nervous system. It's almost like a virus or a bacteria in a way, that somebody can have knee pain, and then suddenly years later they just ache all over. And we'll go through why that is. So the solution they commented and concluded is a patient-centered approach, which is exactly what we try to do here at the center. We take every patient individually, holistically, and look at why they're in pain and why they're having the symptoms that they are. Okay, so 5% of Americans use painkiller for non-medical purposes, meaning they're hooked on them. That's a report by the CDC, the Center for Disease Control. 40 deaths each day are due to prescription painkiller abuse. We hear about all the terrorist attacks in San Bernardino and those are absolutely terrible. Those are usually less than 40 people. 40 people every day are dying just in this country with that. Okay, and from 2010, and I'm sure these are worse now, the drug overdoses, the deaths for the drug overdoses every year outnumber car crashes and firearms. Firearms are another big topic at this political debate, right? And it's sad that many people die from firearms, but who talks about the drug overdoses? Yeah. 90% of addicts started using the prescription drugs in their teenage years, probably from their parents' medicine cabinet. So I'm going to go through a couple of the classifications of the prescription painkillers and what they can cause. So the opioids and narcotics era, 18,000, 893 American deaths. This was I believe in 2015, so it's probably a little worse now. Nausea, constipation, insomnia, sluggishness, brain fog. I found this funny, worsening pain. So you're taking it for pain, but it's making your pain worse. And at 1.9 Americans currently addicted. Okay, the NSAIDs, which are more often over the counter, there are a few higher intensity prescriptions. We think of Advil in that as some of them. So 140,000 heart attacks in 5 years. Strokes, the big ones with these is the GI ulcers and bleeding. 7 to 10,000 deaths and 100,000 plus hospitalizations every year. Aspirin. Aspirin's great, right? It's safe. It's from willow bark. We can just take it. Well, Got those GI and the ulcers again. Brain bleeds, Rise syndrome. That's for infants given aspirin. They develop this encephalopathy, this swelling of the head. So that's a no-no. H. pylori infection because you're opening your gut up, right? If it's destroying your gut. Crohn's disease, which is an autoimmune of the gut. It's preventing blood clots. So God forbid if you cut yourself in the kitchen, you can't get it stopped. You've got to go to the emergency room. And may increase risk of fatal heart attack. I'd rather not find out. And then the antidepressants, anticonvulsants, is into the two subcategories. So your antidepressants and it's giving you suicidal thoughts. That's a good way to go. Constipation, diarrhea, nausea, vomiting, mouth pain, black tongue, appetite, weight, sexual dysfunction. No, thank you. And the gabapentin, which a lot of my patients that present with neuropathy are instantly put on. It's called called Neurontin. The generic gabapentin, dizziness, drowsiness, memory loss, lack of coordination, difficulty speaking, viral infections, double vision, fever, unusual eye movements, and jerky movements. Yeah. So, and this they do have to disclose this all, but it's in such small print that you need a magnifying glass. Yeah. Tylenol. Okay. So liver damage with high dose. So it's never to be combined with alcohol or used as a hangover cure because your liver is probably already compromised in that situation. 33,000 Americans hospitalized annually and 1,500 die of complications. Just Tylenol. A couple facts. So Pfizer pulled this particular NSAID from the U.S. market because of heart risks, but also it was linked to more than 150 cases of serious, if sometimes fatal, skin reactions. You don't want to think of skin reaction with pain. And it launched in 1999. They had COX-1 inhibitors before. These COX-2 inhibitors were supposed to be lighter on the stomach and the stomach lining and the gut. So they launched those in 1999. They were on the market till 2006. They said 10,000 people had heart attacks, which they withheld the data. Waited until published until 2006 from their trials. Because of the data presented, they never would have gotten FDA approved. And 55,000 death toll from Vioxx. That's more than was killed in the first Gulf War, both air and land. And I found this interesting too. So the NSAIDs can actually make pain worse. So they interfere with the body's own pain-killing mechanism. And then they say they're non-addictive, but they make for a rebound pain. So when you stop them, your pain level increases so much that you want to reach for something, maybe even something stronger. So are they the gateway? I don't know. Okay, so that's all the sad news. Here's the good news. Pain therapy is here at Center for New Medicine. So the new is the biophoton device that I've come up with, but that's not all. We also have pulsed electromagnetic field therapy, which we also use for cancer treatment. Acupuncture, Prolozone, PRP, which is platelet-rich plasma. And I want to go through a few related, the nutrition, the far infrared sauna, and some of the psychological tools we use, and then we'll get into the supplements. Okay. So what is a biophoton therapy? Biophoton therapy is a high-intensity LED therapy which uses incoherent light. That's opposed to laser, which is coherent light. The definition of a laser is like a laser pointer. You can point it at any surface, whether it's 1 foot or 1 mile away, and it'll be the same exact size. That's coherent light, right? Well, coherent light is great for a little laser pointer, but it's actually quite dangerous in a device because of the retinas, the eyes, and actually burning a patient. So it's much safer to have incoherent light as it fans out and it spreads out. It's not so intense and not near as hard on the eyes. A few of the physics. We'll go back to high school really quick. This is the electromagnetic spectrum. Over here is all the bad stuff. Oop. It's trying. Go back to show. Yeah. Play from current side. Yeah. Come on. You can do it. That's weird. Don't touch it. Don't touch it. Okay. So back from high school, all the bad stuff is over here. Gamma rays, X-rays, ultraviolet, all the free radical ionizing radiation. Then we have the visible, and then we get into infrared over to radio waves. So the biophoton uses blue light, red light, and near infrared, which is in here. Each of them have different properties for healing different tissues. It's the first time a device has had all of them in it. Previously, I actually still have a laser. It just has near infrared. People make red lasers. People have blue. We have one device that has them all in there. It's kind of nice. The blue light is really good for skin surface and lymph drainage. It doesn't go much past the dermis and epidermis, the skin levels. The red light permeates in about 1 centimeter, so it's good for more shallower muscle tissue, and the near infrared about 20 centimeters. So you can do a lot of organ work with that if someone has organ damage from an accident or a post-surgical or something. So, and again, it doesn't produce any ionizing radiation. So what does it do? The infrared light, they know, increases the production of nitric oxide. That's NO. That's kind of like the hot new molecule out. It's been known for quite a few years, but we're seeing it at a lot of the integrative medical conferences. It's a vasodilator. It opens up the blood vessels. So we all have a certain amount of nitric oxide, but a lot of times it's locked up in the deoxygenated hemoglobin, the device that carries oxygen around our system. And it allows it to be released, thus allowing vasodilation to get blood to an area to promote healing. It produces collagen and fibrin. That's to help repair the soft tissues. Increases the thickness of epidermis. Again, that's like in a wound healing application. It'll help with skin. Lymph flow, that's the blue. Osteoblasts are the cells that help repair bone. So after a fracture or a bone break or something. Cell proliferation, granulation tissue, this is what mechanisms for wound healing. How a wound heals, say it's a circle, you notice it gets smaller and smaller and smaller. Those little granulation tissues are around the outside working to shrink it down. Well, if you have a wound that's open, you're at risk for infection. So the faster you can get that healed, or at least get it covered over with a fresh layer of skin, the better. It helps with that. And then ATP, adenosine triphosphate, is the little energy cell for all, at least mammalian life, a little energy cell. So it gets that going. And I could go on and on with cell biology, but I think I'll show you a few thermal images from before and after treatment. It's a great way to track it. So these are the bottom of someone's feet. This was actually a yoga instructor with type 2 diabetes. She has diabetic neuropathy. You can see how inflamed it is here on the side, so before and after. She's still not perfect, but that's after one treatment. So this is all temperature. I'm sorry, this was 4 days. Sorry, 4 treatments, 4 days. Still pretty good. This is pure temperature data. Thus, it's the camera that, the camera doesn't lie, so it's showing for sure that it works. I didn't touch it. I'm barely, okay, right there? Okay. Okay. Really careful here. Okay. So you can see the top images are pre-treatment and the bottom are post-treatment. This one was one treatment. You can see the person's toes are about the same temperature as the floor, both on the top, the dorsal, and then on the bottom on the plantar aspect. And you can see before and after. The little circles are taking averages of temperatures. So the little one circle is 23.4, and then that would correlate, or we can even say 2 is 25 degrees, and down here it's 28, so we rose at 3.4 degrees Celsius. Medical use Celsius. So it's a great way to track it. Unfortunately, with many of our cancer patients, we see chemotherapy. Chemo absolutely destroys all of the dividing cells in the body, and those can be taste buds. We have dividing cells all the time in our gut. Obviously, our gut's replaced every 3 to 5 days, and then in our hands and the sensory areas, our face. So this was the bottom of the feet, and you can see this was a series of treatments. He was having chemo for melanoma and had this chemoneuropathy, so you can see before and then after, almost perfect, restored. You don't have to always use infrared. Visual, this was after a car accident, so that's someone's heel and then down their calf. And this was after 12 days, but one thing nice, it's still visually and cosmetically unappealing, but it has healed over. So the risk of infection now has gone way down. Yeah. It's probably a little bit overkill to use this for acute conditions, but that's what a tennis elbow looks like. You can see that's their right, our left side compared, and then after one treatment, it's more normalized. Yeah. Achilles tendon, any guess which side has the Achilles tendonitis? Okay. Again, probably a little overkill. Interesting, even in the medial and lateral gastroc, the soleus, the calf muscle on the left is a little inflamed. That's probably from compensation, because they're probably walking. Yeah, because they're using the other side. So I would actually treat both, with most of the most of the treatment being administered on the right. Same thing with the hamstring pull, before and after. If you image someone that's having a migraine or some kind of headache, their whole head is just on fire. And you can see here that she has a history of cervical disc headache. I will add here, the image does look better, but there probably is something else going on with the headache. And I don't like it to be a Band-Aid treatment, so it's great to get somebody out of pain without the drugs, but probably here at the center we want to do a little bit more blood work or something just to see what's going on, why the person's getting the headaches. RSD is called reflex sympathetic dystrophy. This was before and after. Basically, the sympathetic nerves, which is the S, control blood flow. They're not getting the circulation needed to the feet. You can see the toes are just really cold. So this is after one treatment. This is called cold RSD because it's a progression. If they present with the acute phase of the RSD, they'll actually be way too warm. And then the body stops trying to heal it and it goes cold. So using the thermal camera, you can tell what stage they're in and also where to apply treatment. And I didn't mention before, but you can image during treatment. So you take the pre-image, put it in hold, pause on the screen, and then have this live going, and then use the biophoton, and you can see the blood circulation changes live. It's pretty cool. Thoracic outlet syndrome is usually due to a seatbelt crush injury. This is bilateral. It's on both sides. Usually it's on the side that you're seatbelted, so if you're the driver or the passenger, it's going to be different. But again, with the ovals, this time we're warming up here from 26 to 29 degrees, so about 3 degrees centigrade increase. This is going to take some treatment, so the thoracic outlets, it's a difficult, it crushes all the nerves up in where the seatbelt is. So that's for the biophoton. But there are other therapies we do as well. So PEMF, pulsed electromagnetic field, and it delivers magnetic waves to the area of treatment. It's a machine that has a big capacitor bank. It charges up, and then it puts electrical current through wires. You're not shocked because the wires are insulated from you, but when you generate an electric field, you generate a magnetic field. There's a couple different types of pulsed electromagnet that we use here. Some of them are as strong as an MRI, that's the big machines, and then some of them are as weak as we can make as weak as the Earth's magnetic field. We can also modify the frequencies of these pulsed magnetic waves. It's theorized that different frequencies benefit different tissues and are good for certain indications, like certain set of frequencies program is good for insomnia. One other one might be good for muscle cramps. So we can tailor it to the patient's individual needs. This is dark field microscopy, very, very powerful microscopy before and after. So it was looking at that clump and then why they did the PMF, and you can see it loosens up all of the clumped red blood cells. And I believe there was a white blood cell in there too, which is now unclumped. So it actually, if your blood is clumped up, it's actually inhibiting your whole immune system from healing, because if it's keeping the white blood cell from getting to the area it needs to go. So it's just proving, just like we did with the thermography for the biophoton, we're proving that the PMF does something. So what does it do? Breaks up scar tissue. You feel with the intense machines, you feel a kind of a pulsing, like a tapping type sensation. So that's physically breaking up the scar tissue. It helps increase that ATP production also, but it induces a charge on the mitochondria, the little powerhouses inside the cell, and kicks them into gear. Allows for greater uptake of nutrients. The key word here is electroporosis. If anybody wants to go with electroporosis, you're electrically changing the porosity of the cell wall to get the nutrients which are in the extracellular space, the space outside the cells, into the cell, and also getting the waste products out. If you think of pain and damaged tissue, it's like that car on the freeway that's going 35 in the slow lane that's belching smoke out. It's going, but it's not working correctly. Or think of it as a weak or a dead battery. With the PMF, you're charging it up. You're inducing a charge to get it to fire, because the cells are electrical, just like we are. So it helps expel the waste, repolarizes the cells. The cells have a north and a south, just like the Earth does. So some of them, cancer cells, have lost their polarity, and they're running at about 10% of the energy of a normal cell. Increases the cell voltage. Nice with the PMF as opposed to the biophoton, this will actually go right through the long bones and joints. So PMF for joint pain is quite a bit better than the biophoton. That's where it really shines. And it doesn't interfere with other physiological processes. Okay, so the types, as I mentioned, the high output are up to 19,000 Gauss. It's non-programmable though, so you're not able to select the frequencies with that. And then the low output, the one on the left only goes up to 100, but it's programmable with different waveforms and different frequencies for different indications. What is it good for? So as I mentioned, the joints, arthritis, osteoarthritis, even rheumatoid arthritis, although that's harder because it's an autoimmune disease. Bones, breaks, and fractures. Any kind of cellular damage, because you're pumping up the mitochondria to get the cell working again. Soft tissue injuries with previous injury, scar tissues. It can be an injury from 20 years ago that someone had range of motion issues, and it helps break that up so they can actually move their joint better. And old injuries that just won't heal. If you take an image of an area of pain, the thermal image, and it's cold, it means the body's given up on healing it, because there's no inflammatory process there to do it. So it's very easy to tell if the body's not healing something. That said, the heat image does not go into joints. It's just for soft tissue, because it's just taking the tissue. So you can't see inside the joint. But Okay, I am an acupuncturist. Stand back, I am an acupuncturist, it's okay. And I like acupuncture for pain management. I do prefer some of the devices. I'm also an electrical engineer, so I'm going on that side first. But I did want to put a slide in here because acupuncture does work. How it works, it's an ancient Chinese medical system, about 4,000 years old, and everything is mapped along meridians. Meridians are like freeways on the body, okay, and they intersect, and they do all this to shuttle qi or energy around. Well, the Chinese believe that the only way that pain occurs is when the meridians are jammed. It's like the 405. When you sit on it and it's jammed, it's painful, right? Okay. So we need to alter the energetic force at a local area, moving this qi to free flow around. I like to use it in conjunction with the biophoton and PMF. I found out from when I was doing my little residency at Rady's Children's Hospital in San Diego, what I was doing in 12 treatments down there, I can do it in about 4 now. So it's a lot less time and money for the patient, and everybody's out of pain faster. Everybody's happy. Okay. So Anne, our nurse practitioner here, does prolozone. This is another therapy. So there's prolotherapy, which has been done for over 100 years. Prolozone is the prolo with ozone. I looked it up. Prolo is short for proliferation, so growth or formation. And the ozone, which is the addition from the original prola, is an O3 molecule, so it's 3 oxygens instead of just 2. And it stimulates the fibroblasts. Those are the cells that produce collagen. So it makes the prolo work a lot better. Really good for ligament and chronic pain treatment. Ligaments are really stubborn. They have 1/10 of the blood flow of muscular tissue. So they're really, really slow. And tendons and all those, the connective tissue is really, really slow to heal. So I think that the prolozone is really good. I just treated 2 patients today that she had done prolozone first and then did the PMF afterwards to make it work better. That seems to be a really good combination. The connective tissue is injected with this cocktail of collagen-producing agents and the ozone together, and it's typically 3 treatments, 1 to 2 weeks apart. So it's not like 20 treatments or anything. So I really like that combined. And then Dr. Shannon here at the center does PRP, the platelet-rich plasma. This is kind of the next level up from that prolozone. So the patient's own blood is drawn, and it's spun down to concentrate the platelets. So there's a lot higher concentration of platelets, and those are really good. It's injected into tendons, ligaments, muscles, and joints, and those are really good because they contain all these proteins that have the growth factors to help heal. So this is a little more pricey. If someone has pain, I usually say, let's try just some PMF. I think we charge $45 for a PMF session for pain and more for the cancer because it's a longer time. Try that. If that doesn't, try the prolozone. If that doesn't work, the PRP will work. So that's kind of the order. This here runs about $300, depending on how many sites. And I will say it is a deal because a lot of other clinics in Orange County are charging $800 or $1,000. So it's that we try to keep it cheap. We have a high volume of patients here, as most of you know, so we're able to keep the prices on these machines and the therapies down. So, okay, so I wanted to throw in a couple other of the pain treatment therapies that we're doing. I think it's really good to see Liliana. Liliana's our nutritionist. With her goal through diet is getting the inflammation down, because inflammation is your body's way of healing something, but too much of a good thing can lead to too much pain. And you can self-inflame with some of the foods that you choose. And different people are just sensitive to different foods. Liliana has some great energetic testing ways of finding what you're sensitive to and then getting it out of your diet. The psychological counseling, Evox is another device. Excuse me. It's a biofeedback. It actually monitors someone's voice. So let's say you get up in the morning sometime and you're angry. You're just angry and you don't know why. It helps you pinpoint through tone when you're talking to the operator of the Evox what's going on so that you can work it out. Because pain, after all, down there, woo, got me. Okay, it'll go. Pain, after all, is just an electrical signal to the brain. So pain is, it's just a current. So it's perceived. So if there is some psychological involvement, and I would assume with a lot of chronic pain patients there probably is, there's probably a lot of frustration, probably a lot of anger, right? Why do I have this? That might be an option to see what's going on. And I believe that a lot of the chronic pain patients they're almost always toxic, especially if they've been on all those opioids and all the synthetic drugs. The far infrared sauna is a great way to detox. And just if you can't get in that, sweat. Okay, that's how we get rid of most of our toxins is sweat. It's not urine. Okay, and then A couple other therapies on your own, like meaning at home. For acute muscle strain, I say ice within the first 24 hours, elevation and rest, okay? After 24 hours, I really don't recommend ice anymore because if you ice somebody, you're driving all the blood away, right? Well, the blood's what has all the white blood cells. So if you image somebody that's iced with the thermal camera, I mean, it has no blood there whatsoever. I think it forms more scar tissue. I think it's going to make it a lot more time to heal. And I think we'll get to in a second, if you're using ice for a pain relief, there's a lot of other natural supplements you can be taking that won't interfere with those healing processes. If it's more topical, you can apply the homeopathic Traumeel or Arnica. Those are two good products that we use here. Okay, so supplementation, I'm going to be talking about those. We'll start with curcumin. This will be on Facebook, so anybody can go later and hit pause on that slide. And also, I don't mind if this is posted on Facebook as long as it's copyrighted by me, but anybody can view it. So, okay. So curcumin, it's a concentration of the highly pigmented flavonoids in the turmeric root. I show the turmeric root and then the powder here. We actually do curcumin IVs here. We're one of just a handful of clinics in the whole United States that actually do the IVs. They're very hard to come by. The IVs are so potent they actually stain the bag. Wow. The vitamin C and vitamin B don't do that. It actually stains the plastic on the bag. One IV that's 500 milliliters is, I think, like an acre of these turmeric roots. You know, squeezing blood from a turnip, well, try squeezing curcumin from yeah, it's really potent. And they're mainly grown over in India, but it's really potent stuff. So I was thinking more for home, but just saying we do offer the IVs here as well. It'll go. Come on. Okay. The combination with fats, phospholipids, is yield a lot more results, not just with curcumin, with vitamin C, with glutathione. Last year at the American Anti-Aging Conference, huge conference in Las Vegas, first weekend in December, the phospholipid versions of all the supplements were the hottest thing. If you put something in a fat, it's a lot more assimilatable as long as you can assimilate fats. Okay, so you can look for those. The pain relief was better than acetaminophen in studies. That's the wonderful Tylenol that causes liver damage. It reduced the need for analgesic tablets post-surgery by 82%. So people didn't need they were given pain meds to take if they needed them. They didn't need them. And improved the quality of life for osteoarthritis sufferers. Those are some of the studies on it. So, okay. Bromelain is from pineapples. It's enzymes from the pineapple plant. It reduces inflammation at the injury site. In one study, it promoted healing of the rotator cuff tendonitis. That was by Canadian postal workers. They got tendonitis from delivering mail. And another study, they administered pre-surgery, and it reduced the average number of days for complete disappearance of pain after the surgery. And they did a study of patients receiving surgery for impacted third molars, so back here. And the bromelain users had less pain edema and used less pain meds than the people that just were on the pain meds or on placebo. Why not just eat a pineapple? Delicious, but full of sugar. So, especially if you have cancer, you do not want to have the tropical fruits.
What part of the pineapple do they use?
You know, they're extracting it from the meat and they're getting the enzymes out. I don't know the exact process, but it does ditch the sugar, which is nice. They do have a lot of vitamin C, I'll give them that, but yeah. Melatonin. So we hear about melatonin for sleep, right? But actually for pain management, there's some data on it. So it's synthesized from tryptophan. Okay, and the tryptophan, it's first converted from 5-HTP. Tryptophan and 5-HTP are also sleep supplements, which we carry, and then to melatonin. So it was originally for altered circadian rhythms. If your circadian rhythm gets out, jet lag, right, you can't get to sleep, it was for that. But more recently for pain management, they did a study on cataract surgery, and they found that people needed lower fentanyl requirement, the fentanyl patches. After the cataract surgery, and had less anxiety and should be pressure, less the pressure building up in the eyes, like a glaucoma situation, than the active group. In the active group, as opposed to the control group. They did a study on abdominal hysterectomies, and they showed that the pain scores were lower for those melatonin takers. And they did pre-oral and pre-breast cancer surgery groups and had the same, less pain afterwards. Now, one could argue that maybe it isn't dealing so much with pain, it's helping you sleep better. Because when do we heal? When do we detox? When we sleep. We sleep. NAC is N-acetylcysteine. We carried that here as well. This had just a small study, but I thought it was worth mentioning that its biochemical mechanism relieves pain. So it's not one of the main ones, but I thought I'd put it on there. The French studied the pine bark extract, pycnigonol, and it's actually a natural COX inhibitor, right? No need to destroy your gut while you're going at it because it's natural. They had 100 participants in one study, and it significantly relieved the pain over about 3 months' time. So it's not like popping a painkiller where you're going to pain relief right away. It takes time, but it's natural. You're not going to destroy your gut while doing it. And those people were able to decrease their NSAID consumption, while the placebo group actually had to add more NSAIDs because they needed more and more, because people reach a threshold of relief where they need more and more to make them feel pain-free. Magnesium. Magnesium is a really good mineral. It's good for muscle twitches, cramps, tension, and aches. For my senior patients, they get leg cramps and everything at night. I tell them to incorporate some magnesium, eat some foods that are rich in magnesium. That are coming off my top of my head. Just Google food science magnesium. Get some in your diet. Also for muscle cramps, I should add, it should be on here, coconut water. Coconut water is full of all the electrolytes, of which magnesium is one of them. Yeah, it does. If you put some, shoot it, okay, or put some mint leaves in it. Also, coconut water does have sugar. So we have to, for our cancer patients, we got to be careful with that for that population, okay? And magnesium they do make in a topical oil for arthritis. Didn't even touch it. Arthritis and anything topical, anything in the dermis or subdermal layer, and relieve some arthritis within minutes. So cayenne, so you don't think of peppers as anti-inflammatory. I know if I bite into a pepper, I get relatively inflamed in my mouth. But the capsaicin, which is an extract from it, they make creams from the peppers to use on the skin surface. That's another one. It works by inhibiting this pain transmitter chemical they found back in the 70s called substance P. Substance pain is what they didn't know what to call it, so they call that. It inhibits that transport system. A couple of the foods, Bing cherries and raspberries. I like the raspberries a little better. They're lower in sugar. But anything red in Chinese medicine actually is good for blood. So there's 2 red beets as well, but beets have sugar too. They're nature's own COX inhibitors, and that one study showed they're actually more capable at COX-1 and COX-2 than the ibuprofen or naproxen. So good to integrate. Organic, please, especially the raspberries. Berries are the most pesticided thing on the planet. They're like the top of that dirty dozen list. So always go organic or go home and don't buy any, for the berries at least, okay? As I mentioned, sleep ties in the melatonin. It's when our body detoxes, rebuilds, and heals. And natural sleep aids, getting a good workout, meditation, yoga, exercise, and acupuncture can help with that too. Are good ways to make sure you have a good night's sleep. Okay. Essential fatty acids, so EFAs. So they're called essential because our bodies cannot produce them on their own. The omegas, there's 18 omegas. 3 and 6, which we've all heard of. So the linoleic acid and the linoleic acid for 3 are the 2 that are essential. So we have to take them in through diet. Dr. Kennedy likes me to remind everybody that they lube every cell in your body. If your cells aren't lubed, what do? They stick together. What did we see in the PMF slide? They were all stuck together, right? So they keep everything working. It's funny, omega-3, so everybody goes for fish, but there are flax seeds for the vegetarians and such, and then omega-6s are all the nuts. I think people go a little too crazy with the omega-6 because there's more of a healthy ratio, I believe about 3 to 1 for the omega-3 to omega-6. And if you pile up on omega-6s too much, especially via the GMO stuff like canola oil and safflower oil, it can actually cause more inflammation and decreases. So try to keep a healthy ratio of that in the diet. Okay, and then cellular dysfunction. If you have a lack of these, cellular dysfunction can occur, and it can lead to body aches and pains if you don't have the right ratio or if you're plain deficient in both of them. Most people are not deficient in omega-6 because everybody's eating corn or getting canola oil somewhere, most people, and so they have plenty of omega-6. So the essential fatty acids, so more of omega-3, and you'll be able to zoom in on these online. It's basically all the fish. It's flaxseed, salmon, sardines, cod liver, raw butter, olive oil in that, and then less of the corn, wheat germs, soybean, another bad one, canola, almond, probably because they're GMO. Yeah. So we want more of these and less of that safflower. No flour there. So, and then the ratio, here's your 54. We say 3-to-1. It's arguable, but we say 54% to 33, and then a little bit of omega-9. Omega-9 is not an essential. Your body can make it, but you're probably already getting in your diet if you have a decent diet. And then the other omega is 5.4. This is where I get my essential fatty acids.
Oh. How big was he?
About 20 pounds. It's actually a big silver salmon. And so, yeah, he's in my freezer now. So in conclusion, natural pain relief from nature, nature's pantry, is a very viable alternative to the dangerous and addictive pain meds. We saw the facts, scary facts on those. New technology in the medical device realm allows for proper diagnosis with the thermography and treatment. And I said treatment with live physiological feedback, meaning you treat people while you're doing the thermogram. Not just the biophoton, you could do PMF, you could do acupuncture, that. Of many pain conditions that were previously quoted untreatable. And the combination of the supplements and the therapies have been found to be synergistic. It's great that I treat somebody twice a week or 3 times a week, but what are they doing the other days? What are they taking at home? I found out the consistency really is key. So to be on some of the supplements, having a good diet, detoxing, and getting a few treatments from me, or from Ann or for Dr. Shannon. And at Center for New Medicine, we're here to help. So what I'll do is take questions about the presentation, and then those with personal questions as to what to do, I'll take afterwards. You can approach me. So, okay. Are there any? And then we have did everybody put in for the raffle ticket? Everybody did? Oh, here.
Do you want to take questions first?
Yeah.
And then.
Yeah, we'll take questions first, and then I just want to make sure everybody put in. Yeah. Oh. Quack, crap.
I was interested in the far infrared treatment. Have you heard of biomats?
I have. That's a really good at-home therapy. I like them. Just be a little careful. I was a little cautious because, like with electric blankets, you get the EMF.
Oh, this one has
But the
EMF suppression.
yeah, and I like that. Yeah, just make sure that the one you get. I think the Biomat does, but there's other knockoffs out there that are cheaper and they don't have that, and then you're EMFing yourself while you're theoretically you're detoxing and retoxing at the same time. So.
Your father famous in the military, tracking?
More in the military. He developed the first in 1979 for missile detection. Okay, yeah, he did, and then it was worked its way into, and thermography was actually paid for up until 1992 when Medicare dropped it. So thermography was a lot more popular, and when they dropped it, all the other insurance companies dropped it. It's totally legal, but if the insurance doesn't pay for it, it's not going to be mainstream. So.
Does the insurance companies pay for any of this for your new biophoton therapy?
No, but what I'm doing, if you have acupuncture coverage, you can come in and get some acupuncture, and I'll throw some biophoton in. We can build the acupuncture and just pay your copay. So I'll work with you on that. Yeah, if you're unsure whether you have acupuncture coverage, call the number on the back of your insurance card, ask if you have acupuncture coverage, and ask how many treatments you get, because some of them are kind of stingy. Some of them are like 8 treatments a year or something, and so, yeah.
Biophone? No, biophoton.
Photon? Mm-hmm.
Yeah. Is that kind of new machine?
That's a new machine my father and I developed, yeah.
So does elevate the osteoblastic activity? Does that mean it's good for the
Blastic, okay, so, and remember the osteoblasts are what build bones. The biophoton is okay for that, but I'd go more for the PEMF, the pulsed electromagnetic field, because it can permeate into the bones better. The biophoton only goes soft tissue. Yeah.
So for the osteoporosis, you could use a
You can use a PMF mat, but if you don't have, for bones, the right concrete, okay, the right ingredients in your system, you can PMF yourself till the cows come home, and you're not going to build bone up. Because you can't just lay on a mat and it magically builds your bones up. You need to have a right pH balance, because if you're acidic, which is what I think causes a lot of the arthritis over the years, not overnight, but over like 20 years, it can help break down the bones. Ironically, milk does have calcium, all the dairy products, but they're also full of lactic acid. And lactic acid eats more than the calcium can lay down. So I would say do the dairy, and then Liliana can help you further our nutrition. Those are a few of the key pointers. You can purchase the pH test strips on Amazon, or most of the drugstores have them. I recommend you can spit on them. I recommend urinating on them second void in the morning. Second void because the first void is your detox void because you've been detoxing all night and it's going out in the urine. So if you have a lot of inflammation, pH, I should probably put that in there. pH is another good thing to check that's cheap that can be done. If you are acidic, go on a green juice or a very alkaline diet, lots of veggies, not a whole lot of fruit, some fruit because it has the sugar. So, a long answer to your question, but
You have 2 live stream questions.
okay. Can I take one from Tanaya first? Because
Yes,
she had her hand.
yes,
Okay, Tanaya. Yeah.
Okay, you mentioned for cataract surgery taking melatonin. How much melatonin, or how much for other?
Okay, I can get that study for you. Yeah, it was to decrease pain from the cataract surgery though, not the actual cataracts. Okay, as long as you know. Yeah, I just put this together and I have the article back there, so I will get that to you. Okay, is it live stream?
The first one is who do you recommend curcumin IVs for?
What do I recommend? Okay.
Or who do you recommend them for?
What population of patients? Patients that have systemic pain disorders such as fibromyalgia, or my personal favorites, the new bucket diagnosis is Gulf War syndrome, Vietnam vet syndrome. They changed that, remember that RSD? They changed that to chronic regional pain syndrome. So any areas anything that's more systemic as opposed to just being in a smaller area, anything where you need that full level of inflammatory. Also for those populations, I would check the pH, I would check other systemic functions, because it's great to take an IV if it gets pain away, but it's probably going to come back if someone's really toxic or someone's really acidic.
Your second question is, have you looked into the use of peptides for pain and healing?
I have read some research on that, and that is up and coming. But no, I didn't include it in the presentation yet because I haven't seen enough data yet. If somebody has something, please email me. I'll be happy to review it. Yeah. Okay.
Which one of your treatments would you recommend for pinched nerves?
The pinched nerve would be the biophoton, and I would take the thermal image first to see exactly the severity of it. Yeah. You can also couple the biophoton with the PMF. Or I've even done all 3, done acupuncture, and that's a lot of therapy at once, and sometimes bodies can't take all that.
Talking about water, do you believe in MRET water? It puts water in single. They got the Nobel Prize for it in 2004.
Okay.
And alkaline water, is that?
Okay.
Is that anything?
So what I've come to surmise with alkaline, I'm not a water expert, is that there's a lot of people that buy a lot of expensive alkaline water systems. Why not try to go alkaline with diet first? Number 1, and number 2, is the alkaline water acidified by the hydrochloric acid in your stomach? And are you decreasing your digestive potential by putting a strong, if it's really strong alkaline, down into your system, thus decreasing the stomach acid, thus decreasing the ability to break up, thus decreasing the bioavailability of the nutrients? It's just questions I had. I can't prove it one way or another. That being said, I've had patients that did put a system in, and a lot of their aches and pains went away. So maybe for some people, but I try to do it through diet first. And then the first one, you said, that, I've heard of structured water. Right, where it's more so. I think the theory on that was a single molecule.
I mean,
Okay.
the people that didn't get the cancer in Chernobyl, or it happened to be near this water, this special water that had the water molecules lined up one by one so they could get into the cells faster.
Right.
Yeah.
If it works, I think that'd be great. I mean, theoretically, it would be more bioavailable.
Yeah.
So, yeah.
How long have you been doing, has this biophoton machine been around?
Okay, and I glazed through the history pretty quickly there. My dad actually invented the first one in 1998. So about 17 years ago, the output power was 246 milliwatts. Don't worry about the milliwatts, 246. This new one is 8,900. So him and I designed and had a special LED chip custom made because of the improvements in technology from that time. So we're able to, the old one worked, but we're able to do a lot more with this new one. And my dad's was the first non-laser photon device to be FDA approved.
Side effects?
If you, first of all, you don't shine in the eyes, okay? You can use it with people with implanted medical devices and pacemakers, which is something you can't do with the magnet. And in the 1,000 patients I've done, I have a few people, they were more the fibromyalgia, the really sensitive people. For a couple of days, they were more inflamed. It goes away. It goes away. I've never permanently hurt anybody.
Oh.
So, yeah.
With people with implanted TENS units, will your therapy, cut down on the use of the, they're a stimulator. They put them in and they put the leads.
Right.
You pump them up,
Yeah.
Yeah. Will it reduce the use of that, or can you get rid of the pain?
Reduce the use depends on the patient's situation. We also manufacture a home model, which I rent or sell for patients to use. And the reports have been that it works better than the TENS, but I will say it's on an individual basis. That's why I said before buying it, you can rent it and just see what you're doing. So yes, it can help reduce the pain. Yeah.
What are the costs involved in your machine?
For therapy here?
Yeah.
The biophoton therapy here is $45. Okay, that takes about 20 minutes. Usually start off on the first treatment with a little bit less, about 10 minutes. If it's a more complex case like a nerve impingement, I like to take a thermogram just on the first time, and the thermogram is 150 because it's imaging, so it's 150 plus the 45. Follow-up, you don't need the thermogram unless you really want. You just, A lot of times with the spine, if you have pain at a certain level, that level's innervated by a couple vertebra north of it. So for example, I believe T10 and T11 and T12 are innervated by T7. So the problem could actually be at T7, and you could feel it at T11 or 12. You can see that in the camera because you'll see a hot spot right up there at T7. So I don't believe in making everybody do thermography, especially if it's just a local area that sprain their wrist or something. Then it's kind of overkill. But I think for the harder cases, it's a good idea.
So is this a permanent relief?
It's permanent as long the effect of the biophoton works for about 12 hours. Meaning it's working to commence the healing process to get the blood circulating there. It's up to the body because the biophoton isn't healing you. I'm not healing you. You're healing you. So we're trying to get that process going. The good news is in 2 treatments, the patient's going to know if that therapy is going to work for him. So it's not coming. I mean, I'm not saying cured, obviously, but just saying, okay, it feels better. Let's keep going. So it's not a lot of time and money. Yeah. And I say the same for the pulsed electromagnet for joints. I say the same thing. Most patients walk away with it feeling a little better right away. Yeah.
I'm trying to avoid my 3rd ACL surgery.
Okay.
Is there a non-surgical procedure I could take for that?
Is it a complete tear?
No.
Okay. Then the PMF with the biophoton would probably work. If it's completely torn, you have to get it reattached. What's the minor tear?
I keep twisting it so it rips up a little bit.
Okay, and then after we get the pain gone, I would supplement with some of the one for the collagen or the one for to help you fully repair that. Because if you keep ripping it, meaning it's probably not its full strength that it could be.
Right.
Yeah.
Regarding the pH strip, what's the time you want between the first urination and the second?
Oh no, it's just the second void.
Okay.
Yeah. So however much water, whatever you drink, that takes you to go again after the first void. Yeah. Yeah.
How many times treatments does it take to get rid of the scar tissue?
The scar tissue, as long as the patient doesn't have an implant, a pacemaker or electric device, because then we can't use the PMF on it. With the PMF, usually 3 or 4 treatments, depending on how much the patient can handle and how much scar tissue there is and how long they've had it. But usually like I said, with one treatment, you feel like a little better, a little more range of motion. There's that, so, yeah.
Have you treated with the spinal stenosis?
No, I can't do much for that because it's a structural problem. It's not a physiological, but these work mainly on physiological. Now, that being said, if you have pain with it, that may be a good opportunity to start using some of the curcumin and some of those anti-inflammatories, yeah. Okay. Well, thank you.
Thank you.
You did questions? Oh yeah, go ahead and give the thing. So circa 1983. Yeah. My dad had the camera in '79, so that's me. You can see turtlenecks were in that year, right? And my nose was cold.
Cold nose, warm heart.
Yeah.
Oh, you're just want to pass it down? Yeah.
So would any of those treatments work for bursitis?
The pulse electromagnet is the best for that, yeah, because it's in